I'm glad that you are here this afternoon. In fact, what I'm going to talk about this afternoon, contextual hypnotherapy, probably will parallel some of the things that Scott actually talked about. But maybe instead of bringing up some questions, I'll actually pass along some answers. And I've been pushing for lately an awareness of contextual psychology and bringing that into the world of professional hypnosis. Now, people say to me all the time, what is contextual psychology? That tells me that they're not academics who aren't stuck in ivory towers who don't read journal articles. But if you know what I'm talking about, that means you do read the journal articles, and what the journals are always looking for is efficacy in counseling. To find out what methods work, what methods are most effective. They ask the question, if we do this with clients and if we do that with clients, is there something that seems to work better or more often or more consistently or more effectively? There are a lot of different ways to measure success. And over the last 20 to 25 years, particularly as managed care has sort of dictated how psychotherapy is practiced, there's been a greater evidence on, a greater emphasis on evidence-based treatment protocols. Now, back when I was trained in psychotherapy, this is literally what I was trained to do. I was literally actually trained, here's how you do psychotherapy. Well, I'm glad you're here, Larry. I'm Richard. I'm going to be your therapist. We have an indefinite period of time to work on things because you have an indemnified insurance policy and can come forever. And so, what would you like to talk about today? And then Larry would tell me whatever it is that he wanted to talk about, and I would talk about whatever Larry wanted to talk about. And that was considered good therapy. And the idea here actually was a client-centered approach. Let them bring everything they want to therapy. Along came managed care. I think it was 5 years ago I saw a statistic that less than 8% of the insurance policies were traditional indemnified insurance policies. My guess would be that's probably less than 0.08% in 2012. Everything is dictated by managed care. And I remember being frustrated by managed care, just like many other people were frustrated by managed care. Because back in the day when I was trained to do counseling, I was trained to do substance abuse treatment in 28 days. It was amazing how people automatically all got well on the 28th day. Not the 27th, not the 28th, but everybody, one-size-fits-all treatment, got well on the 28th day. And I actually was working at a drug and alcohol treatment program in Houston when managed care began to rear what many said was an ugly head. I have some strong feelings about managed care, and certainly have seen the downside in my clients' lives, but at the same time, managed care has actually brought us a couple of good concepts. And I decided early on that this was something I needed to work with rather than work against. And so we started doing cocaine addiction treatment without establishing 28 days as the magical number. Instead, we were required by the insurance company to provide, catch this, an individualized treatment plan. At that point, what we actually did when we had a new admission was we would go over to the bookshelf in the office and we would get the treatment protocol 3-ring binder. And if we have a depressed client, we would walk over to the photocopier, take out the depression treatment plan, photocopy it, write their name on it, and put it in the chart. We'd take the cocaine addiction treatment plan, photocopy it, and then stick that in the chart. We'd take generalized anxiety, we'd write their name on top of it, we would stick it in the chart, and that was their treatment plan. And along came managed care at this facility in Houston and said, no more photocopy treatment plans. Everybody needs to be addressed individually and specifically. We're not going to pay for 28 days if they can get well in 17, or in 7, or in 23. Different people are different, and different outcomes and different ways of measuring therapeutic success should be employed. Many of the people I worked with really rebelled against this. In fact, the whole idea that treatment could be, success could be defined differently was really a foreign concept. At that particular facility, we actually defined treatment success as, did he get a sponsor? Did he get a big book? And did he stay sober? And did he get a 1-month chip? Then he could be in our aftercare group because you were successful. And I remember a heroin addict was admitted to this program, And the heroin addict said, yeah, I'm here because I have to be here. I was ordered to be here, and I don't really want to be here. And we said to him, success is going to be measured by abstinence from heroin. And you're going to get a desired chip, you're going to get a sponsor, you're going to get a big book. And at the end of the 28 days, if you remain, of course, chemical-free, you too will be happy, joyous, and free, just like us. And it's going to be awesome. And he said, no, you don't get it. I don't really want any of that crap. He said, look, here's the deal. I've been using heroin for 30 years. I don't really want to quit, but I got some problems. I got legal problems right now. I want to quit getting in trouble with the law. He said, I got another problem. And this was back when the AIDS epidemic was really coming about. He said, so far I've tested negative, and man, my health is in jeopardy. And I realize that. And I don't want to get AIDS. And then he said, look, my job is to put part A on part B of the widget. I've been doing this for 25 years. I'm happy doing that. I live in a small house by myself with 2 cats and no people, and I'm happy with that. I don't want to be happy, joyous, and free like you. I don't want to do anything other than put part A onto part B. I don't want to go to school and become a substance abuse counselor and help other people. I just want everyone to leave me alone. So in addition to having legal problems, in addition to putting my health at risk, he said, I got one other problem, and that is that I'm at risk of death. Not only from an overdose from bad heroin, because the quality seems to be diminishing lately, but the other problem I have is I got to go to the bad neighborhoods to get it. I really don't want all this crap that you're offering me or telling me I have to have. I just want to not get AIDS. I want to not get shot, and I want to not have the law on my back. So the physician I was working with on the treatment team said, oh, awesome, we got a solution for you. It's called methadone. Now, my experience has traditionally been that methadone treatment frees up the heroin addict's heroin money for cocaine purchases. And so it usually becomes a pretty ineffective answer. But here was a guy who didn't want what we had to offer. He made that clear. Look, I only want to put part A onto part B. I don't want to advance in my career. I don't want any responsibility. I don't want to live with any people. I don't want to move into a better neighborhood. I just want to live in my house in the country with my 2 cats and my little garden and have everyone leave me alone. Now, that's not the way I want to live life. But the physician said, well, here's a program for you. And the treatment staff actually wanted us to fire the physician because he wasn't doing it right. That was my first experience in really considering, has the way we've always been doing things, or the way we were trained, best for all people? And managed care really came along and did something for our clients. It said you're going to have to treat them individually and find individual answers for them. The other thing that managed care did was it said, look, we're not going to pay for needless days in treatment. And so we want to know if what you're doing actually works. No more, hey Larry, glad you're here in therapy. What would you like to work on today? You must submit a plan and demonstrate progress. A lot of people said, whoa, you want me to verify that my work was good? What kind of a lack of respect do you have for the counseling and psychology professions? When I think about the field of hypnosis, and I learned hypnosis, I was lucky enough that I learned hypnosis when I was a practicum student actually in graduate school. Last year, if you were here at the convention, you heard my clinical supervisor from 24 years ago actually speak. And so I learned hypnosis way back in the day. But I left traditional psychotherapy behind in 2006 to do nothing other than hypnosis. I run the Tulsa Hypnosis Center, and I only see clients for hypnosis, and I refer all clients for mental health and other issues out. That doesn't mean that I don't have crazy clients that don't want help quitting smoking or have other issues. That's fine. I don't mind working with and collaborating with others. But I market myself and represent myself as a professional hypnotist, doing hypnosis, not counseling or psychotherapy. But it's interesting, when I sort of crossed from the world of counseling over to the world of hypnosis, I found that hypnotists in 2006, 2008, 2009, 2010 were kind of where psychologists and psychotherapists were 20 years ago. We do what we do because this is the way we do it. And I look at training programs for hypnotists, and what I discover is they almost always are singular in their approach to treating clients. use the Joe Schmoanian method of hypnotherapy. How did I do that for CYA? Pretty good? Yeah.
Nothing there's anything wrong with it.
Yeah. Use the trapezoid method of hypnosis. I only use the XYZ process. We only train our students in what is the absolute best process. And then when I ask people for the research that demonstrates that their process is more effective, the more creative marketers will actually show me studies that they produced. Or they'll simply say, you don't have enough belief. Now, I live in Tulsa, Oklahoma, so I can I can recognize a faith healer when I see one. And it doesn't mean that the work they're doing isn't meaningful or helpful to clients. In fact, the research actually shows us that the most important single factor in whether or not the client experiences wellness is
Relationship.
the relationship. The relationship is the foundation of therapeutic success. It actually shows us that the technique that's used is only about 20% of the efficacy of a counseling process. But that doesn't mean that as a profession, we should continue to use either outdated, unresearched, unproven, or truly discounted methods of therapy because some of our clients get well. Which makes us ask the question, if there are methods of therapy which are still used today that the research indicates are less than effective, what is effective? So that's what I'm going to talk about today. What's effective? What could we be doing to increase the likelihood of success with our clients? And the answer to that is using the mountains of research on evidence-based treatment protocols from other disciplines ranging from nursing to psychology to even physical therapy or audiology. You know, one of the things that Michael will talk about is a wide variety of different professions. And I've always looked back at my work, and I still remember a nursing, actually it was a nurse on my unit in an inpatient psych hospital, I think it was actually 1989, who was my very first job sort of in this field. I was working inpatient psychiatry. I hadn't finished my degree yet. I was working as a psych tech. And the blue-haired nurses actually taught me a technique called autogenic training. They taught that to me. And then I went and did the research. And the only place I could find research was in nursing journals. Seemed like psychology forgot this even existed. But it's not a concept that only licensed nurses can do. It's a concept, autogenic training, that promotes wellness from a number of different perspectives with lots of supporting evidence for its efficacy in helping people to experience a wide variety of goals. And so my question is, if I'm a minister, why wouldn't I use some of these methods? If I'm a hypnotist, why wouldn't I borrow some of these methods? If I'm a physical therapist, why wouldn't I borrow some of these methods? If I'm a counselor, why wouldn't I borrow some of the methods? Because I'm not a person who believes in a single disciplinary approach, nor a single theoretical approach. So I think it's important to look at the research from really a wide variety of fields to see what's available that we could integrate into hypnosis. What the research actually shows, 20, 25 years worth of research, is that those counseling or psychology protocols that are based in what are referred to as contextual psychology are among the most effective. And they've been utilized with a wide variety of different clients in different types of situations. And I think all of those methods are easily adaptable to clinical hypnosis and hypnotherapy, which doesn't mean one is providing therapy. In fact, many of these approaches to contextual psychology, it's interesting to me, seem to be much less like Sigmund Freud and much more like coach and student. Wake up, Mac.
Sorry.
I haven't hypnotized anybody yet. I'll let you know when your part is coming up. I got the hard workshop. By the way, whoever did the schedule, this sucks, okay? I told the guy who organized this thing, do not put me after lunch, after everyone's eating a big meal and they're all relaxed. I'm a monotone. I'll put everyone into trance just by talking. He told me no. He said, no, that's your time slot. You're there. I was like, no, please, I'm not coming back to your convention next year if you do that. He said, fine, quit hypnosis, become a chef or something.
Richard,
Yes.
you are truly a relaxed
raspy voice.
Well, thank you very much. And so the idea here is to look at the research and figure out what's really useful to hypnotists and hypnotherapists. By the way, some of you have seen my ramblings on hypnothoughts. If you can decipher my poor typing, I am by nature a lousy speller. I can live with that. But I'm also a lousy typist. In addition to being a lousy speller, if you combine lousy spelling with lousy typing, I don't know how anybody can read any of my posts. People must read my posts on hypnothoughts and then say, is this guy stupid or what?
Two negatives create a positive? Maybe.
Yeah, there you go, two negatives create a positive. Prove that physics theory wrong. But in some of my ramblings on hypnothoughts, you've probably seen me comment on regression therapy. Now, Willie Mitchell talked about age regression yesterday. He said, I'd really like to talk about age regression. He said, I know you don't like that. Who said I didn't like it?
No.
I said it's not useful with most of our clients most of the time, and the research actually supports that. But remember, the relationship is the most important aspect, and with some clients, in some situations, and in some places, there may be a valuable use for that. In fact, I use a regression method with many, if not most, of the cigarette smokers who I see. In fact, I used it with Roy. Actually, probably 3 years ago, Roy wanted to quit smoking. I did two complete sessions. I did one session, he quit smoking, but I did 3 complete sessions in a row, 3 days in a row. Roy, you haven't smoked in a couple of years. Yeah. And I used actually a regression method with Roy. And this is a very common approach in hypnotherapy. Think back to, I asked the client before we ever started the session, when did you have your first cigarette? Let's pretend Roy said 10. I had my first cigarette, I was 10. Every smoker remembers their first cigarette. And in my session, I did what a lot of other hypnotists do. This certainly is a unique use of regression to me. I said, imagine a time in your past before you were 10. By the way, you can use this as a deepening, maybe even 9 or 8 or 7. But a time before you ever had your first cigarette. Not with your eyes closed, a happy time, because I don't want to do abreaction. I don't find any value in that. I'm not entertained by abreaction. And I got another client coming in. The last thing I want is somebody abreacting in my office. Time management 101. People tell me they do directed abreaction. That tells me they don't have very many clients because they're not really worried about their schedule. Because I don't want to lose control of this session with abreaction. So a peaceful time before you ever had your first cigarette. Now remember, bring yourself to a time in your mind, that situation where you had that first cigarette, but for some inexplicable reason, just imagine yourself in that situation not ever having taken a puff of that cigarette. See the people you were with, the places you were, the people you were with, but just imagine that you never had that first cigarette, that you're just sitting there not smoking. Maybe other people are, but you're not. Now bring yourself through your teens, your 20s, the cars that you rode in, the places that you lived, the people you were with, and see yourself as if you had never smoked in the first place. I know it may seem odd to recall something not as it was, but it's amazing how the mind has the ability to do that. And so just imagine yourself in those places, situations, and scenarios as if you never had a cigarette in the first place. Through your 30s and 40s, and bring yourself to today, right here, right now, in my office, in the chair, as if you never had a cigarette in the first place. In fact, though, as you sit in the chair in my office right now, you are, in fact, a non-smoker. You told me before the session started you had your last cigarette. And so even though we know with the intellectual part of the mind that you've had a cigarette before, it now feels as if you've never had one in the first place. And so, future pacing, you can now easily see yourself 3 days from now, 3 months from now, even 3 years from now, from the perspective of one who's never had a cigarette in the first place, as if you simply never chose to smoke. It may seem weird to imagine the future, but we all have the ability to do that. It's amazing how you can create that in your mind, isn't it? Get that affirmation. Awesome. And so, because you have created the feeling, the state, the experience of being one who has never smoked a cigarette in the first place, you'll find that next week, next month, next year, when you're at the convenience store, when you're with your friends, when you're at the bowling alley, when you get in the car, when the telephone rings, when you're angry, it won't be a cue to smoke. In fact, you'll respond to the smoking of others with ambivalence, either desiring to spear them in the head, punch them in the face, or kick them in the teeth, with anger and hostility towards their choices, nor longing, wishing that you too could have a cigarette, remembering what it was like when you smoked, but instead simply, from this point forward, experiencing those environmental cues and the choices others make as if you've never had a cigarette in the first place. We know this is doable. Emo Kuwait, they don't know who that is, but it doesn't matter. After all said, that what the mind can conceive, the body can achieve. And so we know that by coming here today and creating these thoughts, when you leave my office today and step over the threshold of the door, it'll be as if you've never smoked in the first place. I have a lot of other suggestions, but I'll give that. That's really an age regression suggestion. So it's not that I don't think there's a valuable use. But when I look at the research, it shows me that age regression, Freudian psychology, is not among the most effective methods of change work. That's what the research tells us. Scholar.google.com. Go to it today and type in regression hypnosis, regression therapy, and look at the journal articles over the last 20, 30, and 40 years. And what you'll find is that the evidence doesn't support that that is a highly effective treatment method. Now, I think, and I'll give you my opinion, I've never been one to shy away from my opinion, that we can make change today despite where we've been before. And that pop psychology is what has taught us that we can't make change till we understand the past. You know what? Why can't I make a change today and understand the past later? There is a time to go back, and that's relapse prevention work. But I don't use regression work to make a change, because I don't believe that I am the sum total of my past. I believe I am who I choose to be today. That's where the word contextual psychology comes from, in the context of the present. By the way, King Solomon said it best, there's nothing new under the sun. Fritz Perls called this Gestalt therapy, the very idea of the present. And the Buddha, who was really the first psychologist, Buddha didn't know they were going to start a religion called Buddhism. He was really a thinker and a teacher. He was really the first psychologist. Popularized the idea of mindfulness, living fully in the present. The Buddha came out before a number of monks, and he came out simply holding a rose. And all of the monks looked at the Buddha with the rose. And they stared at the Buddha, and they stared at the rose, and they wondered, who is the lucky flower grower who grew this flower? Is he going to give that rose to me or to somebody? What makes this rose more special than the other roses in the garden? And all of the monks wondered among themselves all of these questions as Buddha stood there all morning simply holding the rose. And one of the monks was bolder than the rest perhaps, so instead of talking amongst his friends, he finally asked the Buddha, Buddha, tell us about this rose. And the Buddha looked at it and simply says, it is a rose. The lesson is, don't look for what it means because you might miss what it is. A lesson in mindfulness. The idea in contextual psychology, contextual hypnotherapy, is to bring our clients fully into the present, because either with or without managed care. Here's one thing I've learned, that the last 20, 30, or 40, or 50 years for my clients really was pretty messed up. It really was. When I listen to their stories, it's awful. I'm glad I'm not them in many situations, because they've made choices that were awful. Other people have victimized them. There are things that are absolutely horrendous. Some people had absolutely awful parents who really were truly mean to them and really truly awful to them and really truly taught them a bunch of awful things. But no matter where I've come from, and no matter where I'm going, I can choose right now to be fully in control of my own life and my own choices. So contextual psychology looks at, contextual hypnotherapy, the idea of helping people to live fully in the present. Here's what's interesting. John Kabat-Zinn, University of Massachusetts, the last 25 years, has been researching pain control. And what he's found is that mindfulness-based stress reduction, the Buddhist concept of mindfulness, by the way, every now and then, especially when I'm in Texas and Oklahoma, and since Jerry Falwell did actually sign my diploma, I'm not making that up. People say, wait a minute, he's talking about Buddhism? There's something actually pretty interesting. John Kabat-Zinn's a psychologist who actually happens to be a Buddhist. And he began using mindfulness as a way of helping the Buddhist concept of mindfulness, helping clients to resolve functional pain. Pain that otherwise had no medical explanation. Pain that clients would come see him for when all other hope was exhausted. And he found that by teaching them how to practice mindfulness, they were able to control their pain more efficiently. By the way, how many of you are hypnotists and you work in the area of pain control or would like to work in the area of pain control? The research tells you one of the most effective techniques is a concept called mindfulness-based stress reduction. If I were doing any medical hypnotherapy work, the first thing I would want to do is find out about what the last 25 years worth of research from the University of Massachusetts has given us as tools to help our clients. Now every now and then people say, you mean Buddhism? Oh my gosh, you're going to teach them Buddhism? No, I'm not a Buddhist. I can't teach them Buddhism. I can't remember all 8 of the Eightfold Path. I'm not a Buddhist theologian. I know a couple stories about Buddha. I even know a couple jokes about Buddha. And I know a couple concepts from Buddhism, but here's one of the interesting things, because I do have a degree in comparative religion. All religions teach the concept of mindfulness. Jesus went into the garden the night before his crucifixion specifically to meditate. It's the Greek word. The psalmist in the Old Testament tells us in page after page after page to meditate on the present. Mindfulness is a concept that is filling the pages of Old Testament poetry. From a historical or religious perspective, that's pretty interesting to me. It shows that, oh, by the way, Jewish meditation also has those same concepts of mindfulness, again expressed with different language patterns, but the Kabbalah is a very present-oriented meditation practice and process. Hinduism actually gave birth to many of the world's religions and the rituals and the ideas. You see, religion was how we often understood the human mind, but it doesn't mean that those understandings are inherently religious. And so Phil Goldstein, some of you know who he is, he's written a bunch of books. He's a psychologist from Loyola University in Chicago. He said, this mindfulness thing John Kabat-Zinn's got going on is really pretty interesting. I wonder if we take a Buddhist monk and put him in a PET scan, and if we take a Catholic priest doing novenas in the rosary and put him in a PET scan, I wonder if they would look different. And guess what Goldstein's research revealed? They look the same. They look identical. Which tells a researcher like John Kabat-Zinn, it's not the religion that makes this work, it's the process. So Kabat-Zinn's work has been to take what is a 5,000-year-old religious idea, but that's because we understood the world in religious terms 5,000 years ago, and apply it to a process that helps pain control clients today, with or without a religious component. I'm very comfortable talking to people about what I simply refer to as medical meditation. Now, there are a lot of other people teaching contextual psychology besides John Kabat-Zinn and mindfulness-based stress reduction. I've had a chance to meet several times Stephen Hayes, the University of Nevada. He's done a tremendous amount of research along with a rather large research team, a lot of grant dollars, and with tremendous support from the University of Nevada. And Stephen Hayes is pretty interesting. A lot of people, we get in the field of the helping professions to fix ourselves. In fact, is there anyone who got in this field for the big bucks? Is there anybody who got in the field because they were going to get rich as a therapist? You know, I haven't ever met anybody yet who's like, yeah, I decided I was going to get rich as a therapist. That's it. That's what I'll pick. I'll become a social worker because it'll make me awesomely filthy rich. We got in this field primarily for two reasons. Reason number one, we didn't have to take math to get the degree. Reason number two, to fix ourselves. Horny and Horny, that's their names, Doctor and Dr. Horny. Husband and wife psychiatrists, and yes, they're always horny. They wrote a book, and it's titled Meeting Your Own Neurotic Needs. And it's a great therapy book. Their theory, and I think it's correct, is we all got in this profession to fix ourselves. We all got in this field at some level or another to fix ourselves. Stephen Hayes certainly is no exception. As a socially awkward kid in 1974, not quite fitting in as a counterculture or a prep, he found himself not really fitting in with anybody and being afraid of crowds and being afraid of people and interaction and social interaction and not feeling like he really fit in. So I figured the answer would be to go to psychology school and figure out how to fix himself. So he became a psychologist. And he decided to study how the mind works. But because he's a researcher, he's an analyst, he's an analytical person, he wanted to find out if, because he had been to a lot of therapy himself, if therapy didn't screw people up even more. And it does. Because somebody posted on Hypnosis not too long ago a skit from Bob Newhart called Stop It, one of my favorite skits from the Bob Newhart show. And a patient comes to see Bob Newhart, who of course played a psychiatrist in the show, and the patient basically says, you know, I do this and this and this. And Bob Newhart basically looked at him and said, I have two words for you, stop it. Stop it, stop it, stop it, stop it, stop it. And although that was a parody, the parody is often based in reality. That's really what our approach is often about. In fact, in psychology, there isn't a person who got a degree in the 1980s who didn't learn thought-stopping techniques. Stephen Hayes decided to research thought-stopping technique to find out if you can stop a thought. This is really some pretty important research. Can you really stop a thought? Being a Buddhist also, or at least interested in Buddhism, he had some ideas about meditation, I think wrong ideas that many people have, that when you meditate, the idea is not to think. And he thought, I can't really be a good I can't even fit in with meditation people because I can't stop thinking. So he began to research, can you really stop thinking? And the simplest and best way to demonstrate this is go ahead and close your eyes. Everyone do it, close your eyes. And think about anything you want to except a yellow Jeep right now. You can think about anything you want to other than a yellow Jeep. You can think about roller skating, rainbows, butterflies, unicorns, but no yellow Jeep. Do not think about a yellow Jeep. Whatever you do, block that out of your mind, not thinking about a yellow Jeep. And now open your eyes. And what were you thinking of?
Red Ferrari.
A red Ferrari. No, a yellow Jeep. May have been parked next to a red Ferrari. But the idea here is that when we try to solve an emotional problem, it exacerbates the emotional problem. So his idea was, can we create a set of therapeutic exercises that don't try to solve the problem, but instead help us accept the problem? See, the Big Book of Alcoholics Anonymous has a really important page. It's probably kept more people sober than any other chapter of the Big Book. They re-edited it, so it's not on page 449, but it used to be. And you can Google page 449, Big Book of Alcoholics Anonymous, and you'll see it says, and acceptance is the answer to all of my problems today. Now, acceptance doesn't mean I like something. It doesn't mean I endorse it. It doesn't mean I want it to happen again. It doesn't mean that I wish it would happen to others. Acceptance simply means I am able to simply see it as existing. I can lay it out there in the middle of the room, and I can choose today, despite the past, whether it was my fault or somebody else's fault, to move on from here. That's what acceptance is all about. And commitment in acceptance and commitment therapy, ACT therapy, Stephen Hayes protocol, is about commitment to a core set of values. We'll talk about that here in a minute, because I think that's a component of hypnosis, that we have an ability to truly benefit clients that we often overlook. But the idea of acceptance and commitment therapy is to help a person accept their thoughts, not stop their thoughts, so that they They don't have to create attachments to those thoughts. Let me give you an example with my son, Alex. Some of you have met Alex. Alex is a great kid. He's 16. He's pretty smart. He's actually a pretty awesome kid. I go to yoga with him. He likes to do meditation. He loves to learn things. He really wanted to come this week, but he had a band commitment, so he couldn't. He's many years above his 16. I mean, he's definitely an old soul. I'm not a believer in past life regression, but if there is a previous life, you know, he's probably got one, because this guy's wise beyond his years. So he's been helping me by helping himself eat healthy. So both of us eat healthy. Today I ate the first cheeseburger I've probably eaten in a year. And that's not unhealthy. That's obviously making unhealthy choices sparingly. And so I had a cheeseburger today. But it was pretty funny. I was to Alex. We were on our way to Wichita, Kansas, and we stopped at the convenience store halfway between Tulsa and Wichita, and I needed gas, so I filled up my car with gas. There's a McDonald's there. We were on our way to Wichita. We were going to eat dinner with my older son, and he said, "Hey, Dad, I'm hungry. I'm going to go to McDonald's," because there was a McDonald's there at the gas station. I said, "Alex, I thought you wanted to eat healthy." He said, "I do, man, but I'm starving. I'm going to go to McDonald's." I said, "Now you're being judgmental." "What are you talking about, judgmental? I didn't say anything about you." I said, "Well, now you're being judgmental again, because if I say something, I think it's about me." He said, "What?" I said, "You're being judgmental." He said, I don't get it, Dad." I said, "Well, you said you wanted to eat healthy, right?" He said, "Right." I said, "And now you said you're going to go eat McDonald's. That's not really healthy, right?" He said, "Yeah, right." I said, "So let's stop and talk about it for a minute. I don't really care if you go eat McDonald's or not. I'm going to eat Thai food when we get to Wichita." He knew that. I said, "But you had a thought, and the thought was, I am hungry." Have you ever thought that thought? I am hungry. We can't stop the thought. The thought is just the thought. Thoughts come and go. But we can stop the judgment. The thought is, I am hungry, so therefore I must eat shitty food. That's the judgment. And if we can separate the judgment from the thought, you see, we do that all the time. I am hungry, therefore I must eat this box of Twinkies because there's nothing else. I was judgmental at lunch today. I am hungry. The Asian restaurant we went to that probably has healthy food is going to be too slow. Therefore, I must eat a crappy cheeseburger rather than simply waiting an hour and going to eat lunch right now when I'm done with the workshop. It was my judgment that caused me to make an unhealthy food choice today. My clients say, "I'm anxious." That must mean I must have a panic attack. That must mean I can't fly. My clients say, "My foot hurts." That means I can't go to work today or I can't enjoy life. Judgment. The idea in acceptance and commitment therapy is to do training exercises to teach a person to simply let thoughts be thoughts, rather than attaching importance to those thoughts. You can't stop thinking about a yellow Jeep by trying to stop thinking about a yellow Jeep, but you can detach from the judgments about that yellow Jeep. I don't like Jeeps. I want a Ferrari. Right? I used to have a Jeep. It was pretty cool. I got broken up with my girlfriend in a Jeep once. I mean, whatever it is that we attach to these things. And acceptance and commitment therapy actually uses meditative techniques to help a person detach from the judgments about their thoughts. These are called relational frames and relational frame theory. This is the unique psychological attribute that separates people from animals. Because for a dog, food is just food. In fact, there's a great cartoon, and it's got a guy and a dog walking through the park, and there's like balloons over their head of their thoughts, and the guy has all these pictures in his of all these things, you know, city, car, life, girlfriend, you know, shopping, money, all these things. And the dog, his balloon just has a picture of the tree and the sun that's in front of him. But in the human mind, we have the ability to create these relational frames, things that are artificial, that don't really exist. For example, you know, Beth said, "That looks like a cheap suit you're wearing today." She didn't really say that. This is made up. The relational frame here is, wow, Beth doesn't like me. Wait a minute, that's not what she said. That was my judgment of her thought. And in acceptance and commitment therapy, we simply try to detach from those judgments, simply letting a thought be a thought, an emotion be an emotion. You see, I quit trying to make my depressed clients undepressed. I quit trying to make my anxious clients unanxious. I quit trying to make my angry clients unangry, because that is a futile effort in therapy or change work or hypnosis. Instead, I try to simply help my clients realize that they can be angry. They can be depressed. They can be anxious. And that anger doesn't mean I have to punch my hand through the wall. It means I can just accept my anger. Depression doesn't mean I have to slice my wrists. It means I can simply be depressed. Anxiety doesn't mean I can't fly. It just means I'm afraid. It doesn't mean anything else. And that's learned through a process. And Stephen Hayes' research shows that when we teach these processes, it's a didactic educational activity with a whiteboard and a dry erase marker. The clients who have social anxiety recover exponentially faster than with any other intervention. So here's the question as a hypnotist. Is there anything you can learn from Stephen Hayes that could be useful to the clients on your caseload? Yeah. The answer to that certainly is yes. But in hypnotherapy training programs, we're still stuck in 1946. Regression therapy is what the school teaches. Rather than looking to the current research and saying, what are the multitude of sources where we can draw knowledge from that can be beneficial to our client and apply these? Dialectical behavioral therapy is another form of contextual psychology. By the way, contextual psychology is considered the third wave of psychology. The first wave was Sigmund Freud and psychoanalysis. The third wave was Skinner and behavioralism, which really was fairly reductionist. Freud was crazy. Skinner was a reductionist, and contextual psychology looks at all of them. I think it was Lazarus who wrote in the 80s about a meta-theoretical approach, or responsible eclecticism, I think was the word that Jay Haley used. And we have Freud didn't have any journals to go look at. He just had to use his own cocaine-fueled mind to come up with what he thought worked. By the way, none of us would be here without Sigmund Freud because he really organized them. His contribution wasn't being right. His contribution was organization of the profession. It was the future researchers that has led us to techniques that are valuable. Marshall Linehan's work in dialectical behavioral therapy with some of the most difficult clients. Began with borderline personality disorder. She wrote a book in 1993 called Skills Training Manual for the Treatment of Borderline Personality Disorder. And if you're a therapist and work with borderline personality disordered individuals, you know they become, for many therapists, become the most difficult clients to work with. I've always enjoyed working with them, and the reason why is I've always taken an approach that incorporates Marshall Linehan's work. There's a tremendous body of work, but here's what's cool about her work. Her work is truly useful with the borderline personality disordered individuals and access to psychiatric diagnosis that 99 out of 100 of you will never treat and probably shouldn't be treating in hypnosis. But guess what you do have in hypnosis? The smokers who come to you with borderline personality disorder want to quit smoking. Clients who are self-sabotaging their own life and their own experiences through poor choices because of their borderline personality disorder. And it's a significant population of those who come to seek our help. So we should have, even if I'm no longer doing psychotherapy, but I'm glad I have that base of knowledge so I can make an appropriate referral or work with them within the context of what I know their limitations are and draw on the strengths I know exist with the borderline. In fact, I've come to love the borderline not because I can get them over the border. I've come to love working with the borderline because I have the ability to take their mercurial, flexible, and adaptable traits and use those in hypnosis to help them find solutions. Dialectical behavioral therapy, 1993, was focused on borderline personality disorder. But I work a lot with obesity and bariatric counseling. I love working with the 400-pound guys who, if they don't lose half their body weight in the next 18 months, they die. They come to see me last. They call a hypnotist last. They've been to this diet, that diet, this diet. They've been to the doctor. The doctor's ruled them out for bariatric surgery based on health factors or other things. They show up in my office and they've given up all hope. The hypnotist is the last person they call. And when I look at their eating patterns and their eating habits, I find they have much in common with those with eating disorders, even if they don't have an eating disorder. Guess what? Linehan's research into dialectical behavioral therapy shows me that DBT is an effective tool for those types of clients. DBT involves two components of therapy. One, individual therapy, and two, group work and group support. Because Linehan recognizes that people don't get well alone, they get well when they are part of a community. And I think it's important to be able to, one of the first questions I ask my clients is not, hey Larry, what do you like to talk about today? The first question is really for me. When they leave my office, who's going to be there to support them? How can I incorporate as part of my plan for treatment a connection of that person to the world around them? I'm really big into connections. King Solomon said it best, as iron sharpens iron, so one man sharpens another. And I can teach you all kinds of cool things, but when you leave here, you're going to have real people to live in the real world with. So one of my first actions with my clients, if they don't have a connection, is to help them make that connection. I tell almost all my clients the value of hypnosis is not coming to see me today. The value is in taking what we do today into the real world over the next week or 2 or 3 or 4. And because of that, I teach all of my clients mindfulness. I got into a basic process. I did that yesterday, or 2 days ago. And I tell them, the value isn't in practicing this here in my office right now. It's in doing this every day for 21 days so that intuitively you make the choice to respond mindfully rather than judgmentally in situations where that's useful to you. And so in the hypnosis profession, we look at dialectical behavioral therapy, which also is predicated on teaching clients mindfulness, like mindfulness-based stress reduction, and like acceptance and commitment therapy. We got to ask ourselves, is this something I can integrate into hypnotherapy? And the answer to that is yes. There are a lot of skills that can easily be integrated into the process of hypnotherapy. I view my role as a hypnotherapist is that of a sort of professor or coach or educator. I don't actually hypnotize people. I coach them through using the resources that are already within them. I don't give them something that they didn't have here before they came here today unless it's specific knowledge. I view myself really as a teacher, teaching them how to use what we create in the office. And that's something that Marsha Linehan and her work really focuses on. Some of you are familiar with strategic grief therapy. You know, several years back, my cousin's an LPC in Houston. And we were at a big Thanksgiving dinner or Christmas dinner. We were at my aunt's house. We were all sitting around the table, and Aunt Carla came out with the big turkey and put it on the table. And everybody was ready to celebrate a happy Thanksgiving. And my cousin's phone rang. Ring, ring. He's like, hello. And then my aunt obviously looked disgusted at him for answering the phone. He's like, hold on just a minute. Can't talk right now. Let me step outside. So he goes outside. And we all eat our Thanksgiving dinner. And 20, 30 minutes later, he comes back. My aunt obviously looking pretty upset to his cold Thanksgiving dinner on the table, which he rudely left us to go answer the phone. And she said, of course, who was that? And his answer was, oh, that was a client. And she said, and you answer your phone? He's like, oh, well, I have to really do a good job because I'm a new therapist and I'm trying to build up my caseload to 25 families a week, because once I hit 25 families a week, we won't be starving and have to borrow money from you any longer, and life will be good. And I left that dinner and I thought to myself, wow, my cousin has a real misbelief about therapy. When I get up to 25 families a week, then I won't have to work anymore. You see, this is the only profession where if you do your job right, you're unemployed. Here's a joke for you. I know it's the after lunch hour, so some of you are like, well, I don't know if I can process a joke right now, but this is a good one. And in a little while, like 2 or 3 days from now, you'll be like, whoa, that was awesome. That was a good joke. So let me try it out. In a perfect world, what does one social worker say to another social worker? You can substitute hypnotist, say to another hypnotist, LPC, say to an LPC, minister, say to a minister, nurse, say to a nurse, helping professional, helping professional. So in a perfect world, what does one social worker say to another social worker? Would you like fries with that? Some of you are like, yeah, well, I'll laugh politely. But I promise you, if you didn't get the joke, like 3 days from now, you're going to be driving down the road, you'll be like, that was pretty freaking funny. That actually is. We know we do our job well when we're unemployed. The reason why I like to teach marketing and why I'm good at marketing isn't because I thought I should have had a marketing degree. It's because I realized that if my clients got well, then I would need new clients. And that's how you build a practice, by getting rid of your clients. You do not build a practice by having clients who are dependent on you. Oh man, life is screwed up right now. I really need to go see Richard the therapist. That's awful. Good therapy is my life is really screwed up right now. I'm going to do what Richard taught me when I was in therapy. Because ideally, our job is measured by whether or not our clients leave our care. The strategic brief therapy offers a lot of client-centered tools that are research-based with demonstrated efficacy that show change can be done effectively in a short period of time. There are piles and piles and piles of other evidence-based treatment protocols that I simply don't have time to talk about, that have efficacy with a wide variety of clients. And the literature is out there in the academic journals. And not 1 or 2 articles or 2 or 3 studies. Mindfulness, meditation, and pain control. 191 studies from the University of Wisconsin School of Nursing. 1 school, 1 department. How many schools are there in the country? How many departments are there in the country? 191 studies from the University of Wisconsin School of Medicine. If you teach mindfulness meditation, mindfulness-based stress reduction, acceptance and commitment therapy, if you teach these skills to your clients, you'll have 3 outcomes. 1, you'll decrease complications. 2, you'll incredibly speed the recovery process. And 3, avoid drug-related dependencies and dependencies on medication. Why wouldn't we, when we have a pain control client, draw on the research that's available to us to show what works? In our profession, in the hypnosis profession and the counseling profession, it's amazing. People say, well, maybe it's because I'm a hypnotist who went to hypnosis training and not counseling school. That's why I don't know about these things. It's amazing. When I talk to counselors, like, I teach an ethics class in Oklahoma City in June and December, and I got 30 or 40 counselors in the class. And I'll start talking about acceptance and commitment therapy. I'll start talking about mindfulness-based stress reduction, dialectical behavioral therapy, any of these things, and they look at me like, huh, what are you talking about? All I do is ask them how they felt. Or what's really interesting is when I meet the therapists who in 2012 are still using the methods from 1983 that landed therapists in court. In fact, I was talking to one of the other presenters here yesterday, actually earlier today, about his experience. He said, yeah, I actually did that whole rebirthing therapy once. I said, no, you're not serious. He said, yeah. I said, I thought it was creepy, and it was an awful experience. I said, people have actually died doing that? He's like, I know. We were sitting there, sort of mocking 1983, but I meet therapists in 2012 who literally don't know what the journals say, and they just do what they were trained to do. They do not use the approach to counseling that I was trained in graduate school. The reason why? Because that graduate school is not teaching those methods today. Why? Because those methods are not the methods that produce change. We live in an era where what produces change is being researched and documented. And I think we have a responsibility to our profession, not just to do it the way we've always done it, but to do it the way the research shows is most effective. So I guess this whole hour has been about encouraging you to do that research, to check out those journal articles. In our group, I know Michael and Michael's a big proponent of outcome-based treatment, you and I have probably posted more on HypnoThoughts than anyone with links to these things, etc. And it's amazing. I point these out to people sometimes. They're like, no way, man, all you need to do is do this. And I'm like, dude, the research shows something completely. I don't argue with people too much. Sometimes I like to argue with 1 or 2 people here and there. But the reality is there's mountains of evidence showing that hypnosis really is much bigger than what we think hypnosis is. You know, it's interesting. Those who are practitioners of EMDR, which is another evidence-based treatment protocol, they say, oh, Francine Shapiro says, oh, I don't do hypnosis. Really? Right? But John Kabat-Zinn says, no, mindfulness-based stress reduction is not hypnosis. But close your eyes, take in a deep breath, and pay attention to your breathing. These are all hypnotic methods, whether they recognize it or not. My thought is, let's incorporate that by learning methods of contextual psychology and applying it to clinical hypnosis.
The same thing is true about evidence that shows what's not effective and being harmful. Well, recently, there was lots of research that showed with IBS, it's very responsive to hypnosis, but they note people seem to get worse when you use regressive therapies. When you suggest that at the various groups, you were met with tremendous hostility.
And what's interesting is that journal article in Gut didn't say hypnosis is awesome. What it actually said is the best treatment was hypnosis coupled with cognitive behavioral therapy. That's what they said was best. Now, here's what's interesting about that. A lot of times people think, oh, hypnosis, that must mean my regression technique. That's not what they studied in the article. What they studied was brief cognitive hypnotherapy by Jordan Zarin and Bruce Eimer. Those are the researchers in the protocol that was studied. And sometimes I meet therapists who don't really realize the history of cognitive behavioral therapy. Albert Ellis actually was a proponent of hypnosis who delivered the counters to his cognitive errors while his clients were in trance. And sometimes I meet hypnotists and they say, all right, now that I've done the induction, I've done the deepener, then what do I do for suggestion? And they think they need to do regression or whatever else because that's what Sigmund Freud taught us. Remember, Sigmund Freud quit hypnosis because he didn't have results. He wasn't any good at it. It's not because hypnosis wasn't good, it's because Freud was using regression, because his theory was wrong, because it was 1939. What works is delivering the counters to the cognitive errors. Cognitive behavioral therapy is probably the most researched, evidence-based or outcome-based treatment protocol and integrates perfectly with hypnotherapy. And I say to new therapists who say, well, I'm not really sure how I'm going to do hypnosis, I say, you've probably been doing hypnosis. Do you do cognitive behavioral therapy? They say, yeah. I said, do you have your client? Do you share counters to their cognitive errors? And they say, yep. I said, well, there's your, what we call in hypnosis, direct suggestion. And direct suggestion is, in fact, cognitive behavioral therapy. Now, I don't have any time left because I'm not going to cut into Kevin's time. If you have any questions about what I've talked about, I'm always more than happy to answer any questions. Just a couple things that I want to point out. Have you